Medical coding is the most integral part of an RCM chain. In the United Arab Emirates, Abu Dhabi has mandated the use of standardized medical codes as part of the provider's e-claims transaction reporting. Medical coding services is essential not only as a requirement for regulatory compliance, it's also crucial in the accurate capturing of medical services extended by practice and in translating these services into billable items. Inaccurate coding may result in missing important elements in the EMR, which may impact the statistics and reporting of medical conditions within the emirate of an RCM chain. In 2020, the Ambulatory Healthcare Services, Abu Dhabi's largest primary healthcare provider, managing more than 60 ambulatory healthcare services, in addition to operating more than a dozen of COVID-19 related centers across UAE, hence serving close to 6 million patients with a variety of services. AHS is billing yearly millions of medical encounters, and recently, with the pandemic, this number has increased significantly. This opened up an opportunity to explore any operational potential for streamlining the process via autocoding. That's through a software program script. Autocoding has been known to support coding of medical claims in bulk. So, what's the best practice? Utilizing a process similar to RPA, or robotic process automation. AHS, with the help of Saha IT specialists, performs system modifications in Cerner, AHS, and Saha's EMR. This system modifications enabled AHS RCM, or Revenue Cycle Management staff, to process bulk billings instead of processing one encounter at a time. So while Cerner is widely utilized by other healthcare facilities, not just within UAE, but also all over the globe, AHS separates itself from other healthcare providers who are using a similar EMR system with its variety of services and massive patient volumes, which was greatly affected by a huge number of medical claims during the peak of COVID-19 pandemic. This captivated AHS innovative thinking to come up with an idea of utilizing the same system and enabling auto-coding of bulk medical claims with minimal human intervention. Initially, this process was limited to auto-coding of medical claims that doesn't require manual review. Since the patient of COVID-19 PCR testing had certain repetitive verification steps in the EMR, followed by assignment of codes, this practice was utilized initially for such encounters. In 2020, COVID-19 did not only pose what seemed to be an overwhelming burden on the healthcare facilities and its workers, but also on the medical coders. AHS RCM department then conducted multiple brainstorming and planning sessions with the coding leads, database administrators, and Cerner IT specialists together with corporate Saha in order to resolve this issue. They then came up with an idea to modify the logics within the Cerner electronic medical record system to be able to pick up encounters using identifiers and update the coding fields using the ICD-10 codes together with the CPT codes that allowed for processing in bulk. The task of coding such huge numbers of encounters with limited manpower resources was daunting, as they are working not only on COVID claims, but with all the other medical billings from other services provided by AHS, which did not stop during the pandemic. The deployment of the system was seamless. The same team that were involved in the planning of the autocoding solution were the same people who eventually utilized the system. Failures were anticipated and mitigated prior to the actual deployment. The team also conducted multiple trial episodes under the test domain of Cerner to simulate the system interface, giving them an actual feel, and at the same time prevent affecting patients' medical records and information. After 2 grueling weeks of planning, designing, and implementation, the first batch of claims were auto-coded successfully. AHS was innovative enough to come up with an idea to perform modifications within the Cerner system, together with the support of Saha, and update the logics and codes that enabled the organization to harness the system's untapped capabilities. This has proven to address the issue of processing an enormous amount of medical claims, just with a few clicks on a computer without the need of an army of coders, especially for claims that do not require manual review. This paved the way for the implementation of an innovative approach that was never seen before in the United Arab Emirates. And with AHS being placed in a unique position, being the only healthcare organization that's handling millions of claims because of thousands of COVID-19 services, such as PCRs, vaccinations, COVID assessment centers, and other quarantine services, in addition to their usual services, which is within the scope of its ambulatory care. AHS RCM developed the concept of auto-coding in such a way that it will be a reliable and sustainable and without impacting the quality of coding, as in any risk associated with any new practice that could have resulted in huge revenue implications. AHS RCM carefully monitored the coding accuracy, completion rate, duplication, and missing of encounters during the initial deployment of auto-coding. And while a very minimal number of misses were found, these were easily rectified by the team, and hence any leakage and denials were avoided and proactively controlled. The adaptation of auto-coding concept has truly been advantageous to AHS in both aspects, financial and non-financial. Financially, it allowed AHS to retain manpower cost. Ideally, the coding team should code around 400 medical encounters per day per coder. But with the spike in the number of claims due to COVID-19, in 2020, because of auto-coding concept, a staff was able to process around 4,000 encounters per day and has increased to 16,000 per day in 2021. Now, the good side was that all these additional claims were processed without adding neither additional manpower nor man-hours. Saha and AHS has undoubtedly placed itself in a unique position when it was recognized among the Cerner EMR clients that has submitted the highest number of claims in a single year in the history of Cerner, because of the utilization of bulk coding. Recognizing the value it has added in terms of operational efficiency with its leaner process and reduced unnecessary excessive manpower utilization as compared to the traditional method of claims processing and coding, AHS was asked to internally share the same concept with its sister facilities within Saha, aiming for a similar potential. The auto-coding concept has also been validated by its governing entity, Saha, Abu Dhabi Healthcare Services, through international coding audit standards, thoroughly reviewed and examined by local regulatory body Department of Health and other nationally recognized coding audit companies such as Tasnif, all of whom have given the AHS beyond satisfaction ratings. But with a systemic and strategic deployment plan, this attempt has so far gained some measure of success, as the bulk coding concept has been utilized for vaccination encounters, and soon we'll be able to fully venture out to more complex medical procedures such as wellness screening. The vision of utilizing a bulk coding concept for complex medical procedures is definitely a tall order. Mountains of codes will have to be developed and several trials will have to be carried out in order to ensure success in yet another massive undertaking. But if there's one thing that AHS has proven time and again, is its ability to find opportunity in the midst of adversity and excellence in the moments of difficulty.